My dear students, Patau syndrome. As far as the trisomies are concerned, now we have this third group of trisomies which affects the unlucky chromosome number, chromosome 13, 1-3. So Patau syndrome, as like other trisomies which we have already discussed, like the trisomy 18, which is the Edwards syndrome, and trisomy 21, the Down syndrome. Now, what is important about Patau syndrome is that it has got a characteristic feature that some of the abnormalities are unique to this syndrome, and what we will be discussing will be some of the very important features about Patau syndrome. Now, first of all, you have to remember that intrauterine growth retardation can be an important factor leading to the development of Patau syndrome. Now, how do the babies with Patau syndrome present? First of all, you have to remember that we have got the development of the brain by virtue of three vesicles, and prosencephalon is one of the important vesicles from which the forebrain develops. And in case the prosencephalon fails to divide into two cerebral hemispheres, we get this defect which we call as holoprosencephaly. So holoprosencephaly happens to be a very important feature of Patau syndrome. Now, in addition to that, these babies who have got Patau syndrome also have associated microcephaly. So they would be having a small size skull. Now, the third important fact about Patau syndrome is the presence of cyclopia, and it is again a result of failure of splitting of the orbital cavities, and as a result of which we can have hypotelorism, the decreased intercanthal distance. It would seem that the two eyes look very, very close to each other. In addition to that, there is this important, the cleft defects, the cleft palate and the cleft lip. We know the development of the palate and cleft lip and cleft palate are important ENT anomalies, and they can be seen in patients presenting with Patau syndrome. Now, in addition to these, some patients of Patau syndrome can also present with micrognathia, and micrognathia happens to be a very important feature associated with Patau syndrome. Now, in addition to that, you have to remember that we can have multiple other defects of the eyes. We can be having microphthalmia or even anophthalmia. So the defects of the eyes tend to dominate in case of Patau syndrome as compared to Edwards syndrome, because in Edwards syndrome we have this classic rocker bottom feet appearance, the prominent occiput, the long cranium, the overlapping of the second and the fifth digits over the other third and the fourth digits which are left, and then we have got the Down syndrome. We know the presence of brushfield spots, the Simon crease, the sandal grip, the development of congenital heart defects, especially the AV cushion defects, and hypotonia, macroglossia. So what we have to basically remember is the difference between these three trisomies. I guess this small information would be very helpful to you, and I wish you good luck for your academic pursuits. Thanks a lot.